The district encourages all employees to participate in the wellness program. As a participant in this program, you receive the benefit of reduced copays and deductibles. As a new employee with the district, you will automatically qualify for the wellness plan for the 2011-2012 plan year. Information regarding requirements for continued participation for future years will be shared with all staff during the 2011-2012 school year. Effective September 1st, 2011, the district joined the Regence Blue Shield of Idaho PPO network. The PPO network includes St. Alphonsus Hospital, St. Luke's Hospital, and 95% of all Regence Blue Shield of Idaho participating physicians. Utilizing Regence PPO providers will stretch your health insurance dollars farther. Refer to your summary of benefits in your new hire benefits packet to select your provider and review how your choices will affect your out-of-pocket costs. The Regence Blue Shield PPO network consists of 3 tiers. Refer to your summary of benefits in your new hire benefits packet to select your provider and review how your choice will affect your out-of-pocket costs. For some medical services, you must first pay a deductible. As a wellness plan participant, you will pay a $350 deductible per person or $1,050 per family. If on the standard plan, you would pay a $700 deductible per person or $2,100 per family per plan year. The plan year runs from September 1st through August 31st of the following year. After the deductible has been paid, Regence Blue Shield pays a percentage of your costs. Your maximum out-of-pocket cost per plan year will be $2,000 per individual or $4,000 per family, which does not include the deductible. Aside from the deductible and prescription drugs, all other covered services that you pay for are applied toward the maximum out-of-pocket stop loss. The district encourages wellness by covering annual wellness exams and the many associated labs in full, which includes, but is not limited to, colonoscopy, screening mammography at St. Luke's BCDC, and smoking cessation for those members seeking treatment from Category 1 and 2 providers. Employees seeking treatment from Category 3 providers will be responsible for 40% out-of-pocket costs. Wellness participants' primary care physician office visits require a $20 copayment and specialist office visits require a $40 copayment. Standard plan participants pay a $40 copayment for a primary care physician office visit and a $60 copayment for specialist visits. Immunizations not in conjunction with an exam are covered in full. For most other services, such as lab work, x-rays, and outpatient rehabilitation, you pay 20% after your deductible has been met. These rates assume that you utilize a participating provider within the Regence Blue Shield's network. This, however, will be determined by your choice in providers. Refer to the summary of benefits enclosed in your benefits packet for more detail. If you are admitted to a Category 1 preferred provider hospital, Regence Blue Shield will pay for 80% of the costs incurred for a semi-private room or emergency care after the deductible has been met. Regence Blue Shield will pay 60% of the costs incurred for a semi-private room or emergency room care from any other hospital after the deductible has been met. The prescription benefit requires a $15 copayment for all generic drugs, if a generic is available. If the doctor writes a prescription for a brand name drug when a generic is available, or you choose the brand name instead of the generic, you will be responsible for the $15 copay, plus the difference in cost. If generic alternatives are not available, and your physician prescribes a brand name formulary, the copay is 50% of the cost up to $80 maximum. For non-formulary brand name drug, the copayment is 50% of the cost up to a $150 maximum. Many employees and family members have ongoing prescriptions. An employee may receive up to a 90-day supply of an approved maintenance drug for a single copay. If you utilize a non-participating pharmacy, you will pay the above copays plus 50% of the remaining balance. To get an up-to-date list of non-formulary drugs or prescriptions that require pre-authorization, or to view a list of participating pharmacies, check Regence Blue Shield's website at www.id.regence.com. At the time your coverage begins, you will receive a combined Regence Blue Shield of Idaho and Pharmacy Identification prescription drug card. This card will be mailed directly to your home. If you do not receive your card by your benefit effective date, you should contact Regence customer service. You will need to take the identification card with you to the pharmacist when filling prescriptions.